Hello, everybody. I'm hoping and praying that this is working. For anybody who's here live, I'm Dr. Sarah. I'll more formally introduce myself and my maybe guests, in just a couple minutes. I'm just going to make sure that our video feed is working here. Oh, and I do see us, Katie.
Yay!
On my Facebook page, it says live. Hooray! Awesome. And
technology.
So, hooray, technology. All right. So we'll just leap right in. I'm not sure how many women will be joining us live, but if you're here live, welcome. Say hello to us. I may not catch the comments and the hellos, but if there are any questions that come up along the way, I'll do my best to grab them. And if we don't, for some reason, grab them while we're here live, we'll make sure to follow up in the comment section under the video afterwards. So I'm really excited to chat with everybody tonight. For those I haven't met in person, my name is Dr. Sarah Hardy-Walsh. I'm a lactation consultant and naturopathic doctor practicing in Moncton, New Brunswick area, southeastern New Brunswick, more so now. I'm doing lots of house calls. And with me today, I have Katie Kelly, who is a pelvic health physio here in the Moncton area. And she and her colleague, Erin Matheson, have just put together a new creation for mothers out there. It's called Motherhood Link. And we'll chat a little bit more about that as we're wrapping up today. But I wanted to have Katie and maybe Erin, if she's able to hop on. She's got two little ones at home, so she might be able to join us tonight. Hi, Erin, if you're watching. And so hopefully she'll be able to join us too. But what I really wanted to chat with them tonight is sort of the basics about the pelvic floor and why we need to know about it as pregnant and new moms, so that you have some more familiarity with it and hopefully some resources and questions to ask, or the knowledge of what a pelvic health physio does to help and the type of information that they can give, because they're such a magnificent part of the healthcare team around that transition to motherhood. So welcome.
Well, thank you for having me. I'm very excited to be here. And as you said, I think just knowing that pelvic floor physio exists is a huge asset to mothers, because part of mine and Erin's goals are to make sure that there's an awareness around our profession, so that if an issue does arise, you're not waiting until it's gotten so bad that you have to have been on a wait list for a specialist to then refer to us. The sooner we can see someone, the better. So I find locally our medical community is getting very, very good at identifying women who have issues immediately postpartum, but some women don't recognize issues that they might have at the 6-week checkup. They might only occur later on. So now you're out of your gynecologist's care. And it can be a little bit more of a maybe more barriers to finding us once you've gotten into that situation. So as long as women know that if something does happen in their pelvic floor, in the genital region, that they can come seek us for assessment and for treatment.
Yeah, absolutely. Absolutely. And I find in working with women for the number of years that I have, that I've met a number of women, a decade or more beyond having their babies, and they've been having issues since they had babies. And it's just become so normalized in our culture for women to suffer with pelvic health symptoms afterwards, and passed off as, oh, that's supposed to happen, or, oh, you've had babies and that's what happens, and that kind of thing. So really, really important for women to know that they don't need to go through that for years and years.
And as from a physiotherapist perspective, we're concerned about if you are having symptoms. So symptoms that we're talking about include things like urinary incontinence, the inability to hold back gas, a feeling of vaginal heaviness, those type of things. Those are early warning signs of things that could occur later on. So if we can address that, because that's a muscular or a neuromuscular or a connective tissue problem. So if we can address that before it worsens, then we're hoping to see fewer issues once someone goes through menopause, because that's another kind of hit to the pelvic floor that happens in that time frame.
Yeah.
So I think it is, the awareness is important, and we don't want women to just think that these are things, it's normal, I had a baby, I'm always going to pee myself when I do jumping jacks.
Yeah. Yeah, absolutely. Or chuckle, or, you know, I'm going to have to run to the bathroom really urgently from now on, or whatever it might be. Yeah. Okay. Yeah. So for those women who are tuning in with us, or who are watching the video afterwards, and maybe they've heard the term pelvic floor before, maybe they haven't even heard the term pelvic floor before, tell us a little bit about what the pelvic floor actually is.
So the pelvic floor is a collection of muscles that start at the pubic bone in the front. They sling between the legs. They act a little bit like a hammock, and they attach to the tailbone in the back. They're also called the Kegel muscles. So that's something that's more commonly a lay term that we'll hear people talk about. And one of the things that I find women don't realize is how far back the pelvic floor goes. For instance, if I've asked my patients, are you doing your Kegels? And they say yes. And then I get out the picture. You can see, over here, you can see the picture. That's a picture of a pelvic floor. So you're looking down into a pelvis, and you can see it from the pubic bone in the front to the tailbone in the back. But they're doing their Kegels, and they say yes. And then when I do my physical exam, they're really only aware of squeezing around vaginal opening. But to us, the muscle goes all the way to the back, to the tailbone. So we want to make sure that someone knows that they should be squeezing around the front, and they should be squeezing around the back. The other thing that's interesting about the pelvic floor is that it has a lifting component to it as well. So it's not just this sphincter closure. So when women just think squeeze, they're also missing the secondary component where it should be squeezing and lifting upwards. So those are the two things that I get questioned on a lot when I see someone in the clinic. It's, oh, I didn't know there was a back half, and I didn't know it should be lifting. Okay.
And so to know if a woman is doing some Kegels or has historically practiced Kegels, is there a key way to describe it, like a sensation or a visual that they could use to kind of visualize that squeezing and lifting?
Sure, because we can't see that muscle. We're not like men. Yeah. We can't see when we lift things and when we lower things. How we usually train women is we tell them, pretend like there is, you can use a jelly bean or a blueberry or whatever. Pretend that there's a jelly bean in the vagina and one in the anus, and don't just squeeze your beans, lift them up towards your eyes.
So that's the sensation. Squeeze the beans and lift them.
Yeah.
Okay. It's a good kind of visual to have, because you can see, you want to kind of like pick them up and pull them up.
And let me be clear, don't put jelly beans in your vagina and anus, please.
Yes. A visualization, not actual experimentation. Mm-hmm. Okay. So we have these muscles then that go from the pubic bone back to the tailbone. And like you say, they're kind of like a sling. Do they have specific roles or even additional roles during pregnancy and labor and birth? Oh.
You're cutting out a little bit, but I think you're asking me if that. You're cutting out just a bit, but I think you're asking me, do the muscles have roles for pregnancy and birth? Is that correct?
Yes.
Okay. So in pregnancy, what happens is there's an increased load on the pelvic floor. You have a baby in there that's getting larger and larger. So we'll often see urinary incontinence that can happen during pregnancy because there's a progressively increasing weight. So that muscle has to be strong enough to cope with the pressure that's coming down from baby. And that's where we'll see women who become leaky during pregnancy, that will experience vaginal heaviness during pregnancy, but it can also contribute to pain. So you can now have pain with intercourse. You can have pain with things like walking, standing on one foot, going upstairs, turning in bed. Those are all very, very common. Okay. When it comes to labor and delivery, what we want to see is a strong but flexible muscle. Okay. So because there is this issue of urinary incontinence, and women are concerned about that both during pregnancy and in the postpartum period, we see a lot of women that are trying to do their Kegel exercises. Yeah. When you are trying to birth vaginally, you want to make sure that those muscles can relax and open. So although the Kegel is the squeeze and the lift, what we want to see is the opposite, is that they can also lower down and open up. And that's one of the things that I find gets ignored when we talk about birth training, is that we'll talk about all the Kegels and the exercise and the strengthening, but we won't talk about how you need to have good control to relax and open for vaginal delivery.
Yeah, that makes sense. That makes a lot of sense. And some of the strength that comes in with the need for strength in that muscle, the way that I heard it described once, and it stuck with me, is that if the muscle is strong and the baby's head is descending in the pelvis, that it'll kind of bump up against that muscle a bit and cause the baby to tuck their chin in. And that means that the crown of their head is moving through first. And if you look at even some baby dolls, the crown of the head is smaller than the top of the head. And if that muscle is a bit weak, then they don't have that little bit of resistance to help them tuck their chin.
Yeah. So it's interesting because when it comes to birth, there's so many factors at play. We're looking at, you want the proper cascade of hormones. You want labor to be an appropriate length of time. You want baby to have descended as optimally as possible. So the pelvic floor muscles are just one factor in that cocktail of birthing scenario. But yes, certainly you want to have muscles that are working as optimally as possible so that the rest of the processes can kind of follow suit in the way that we want to see.
Yeah. Okay. So some tone, but also, like you say, relaxation enough so that the baby's able to fully descend and come through the pelvis.
It's always a balance between being strong and being flexible.
Yeah. We hear that in all areas when it comes to muscle training, right? But less about those particular muscles.
Well, we just don't talk about those particular muscles much at all.
It's true. It's true. Yeah. Because, well, what did we get as kids? Don't talk about it.
No.
Or we don't talk about that. Okay. So for the pregnant women who are watching, there's probably so many things, and depending on each individual woman and their assessment and their needs during pregnancy, but is there one thing that every woman can get started with when it comes to preparing their pelvic floor for labor and birth?
So if you're aiming for a vaginal delivery, the number one thing that I talk about is that pelvic floor muscle relaxation. Ideally, I'm giving them Kegels and relaxations, but ultimately, we know there's going to be a weakness after birth. We know they're going to have to Kegel in the postpartum period. So I find that women find the relaxation exercises more useful and more empowering for having a vaginal delivery. So that's something that we review with all of our women that come in and that are attempting a vaginal delivery. So I teach them the Kegel, so they hear my jelly bean talk. And then we talk about the opposite. So it's now your beans are up. Can you bring them down all the way? So to make sure that there's an awareness of the vaginal relaxation that's happening, but also the back half. And I find one of the problems that we encounter often is that when women are pushing, there's such a fear about having a bowel movement while they're on the table that we'll have women that really don't want to relax in the back half of that muscle. It's the same muscle though, from front to back. If you're holding tension in one half of it, then it's not a full relaxation through that complete muscle. So we will get women to practice that relaxation component numerous ways. I'll have them practice it, building awareness when they're having a bowel movement on the toilet. I'll have them sit on a pool noodle and try to feel front versus back. We'll have them sit on exercise balls. I'll even get them to take their you can't see me this way, the 2 fingertips, put it near their tailbone in the back and see if they can feel a relaxation so that the tailbone is kind of drawing backwards like a dog with a happy tail. And then when they Kegel, for it to draw forwards like a dog that's in trouble with his tail between the legs. So you should feel that, both of those motions. But really, I want them to know, most of them have an idea of what a Kegel is. The majority of them don't have an idea of what a relaxation is. So that's really what we review.
Okay. And so if if they're beginning with doing that on their own, I think of that 2-finger exercise to kind of put those 2 fingers to the tailbone and just notice where it is to start, and then to do a Kegel and feel their fingers move slightly forward, and then to relax. They need to go probably relax even further back than where they started.
Yeah, so I find a lot of women can't tell when they're relaxed or not because so many of us hold and guard and grip through the pelvic floor.
Yeah.
I will often pair this with a nice belly breath. So if you've done any sort of diaphragmatic breathing or any sort of yoga training, what will happen when you do a really beautiful belly breath is that the lungs will fill with air, and that will press down on the organs in the abdomen, which will in turn press down on the pelvic floor. So we'll get that nice lengthened position. So if they're really struggling and say, I can't feel it, I can't tell, I'll get them to get into whatever position is comfortable for them and to start doing some belly breathing. And then they can start to feel that lengthened, that relaxed position that we're looking for.
Okay, so the relaxed position, the lengthening should be when that breath is in. So they're bringing it right deep down into their bellies, and that's when they should feel the tailbone move backwards.
Ideally,
yeah. Okay. And so the other thing that I think of, it just popped in my mind when it comes to those of you who are pregnant and listening in, is that if you have extended health benefits that cover physiotherapy, this is just a random tip that goes along with it. If you don't already have a prescription from your doctor for physio, get it now. You're seeing your doctor often now. Ask for that prescription, because all the insurance companies usually need is something on file that lasts 12 months. And that'll save, if you are wanting to get that support prenatally or even soon after baby arrives, then it's less that you have to do when that time comes.
We find the postpartum period so busy. A lot of women will say, well, I'll save my insurance until I have the baby. There's so many skills that you can learn prior to delivery. And Erin and I both treat for vaginal and cesarean. So I do birth preparation for all types of delivery because it's more common now to see vaginal deliveries turn into C-sections. Yeah. So in the past where I would have agreed come in after the birth, now more and more what I'm learning is come in if you can do it, come in before there's a tiny baby to take care of. Come in, master the exercises before the delivery, because after the delivery, you're going to have more things to do. You have just natural recovery that has to happen. You're going to be fatigued. You have a tiny human being to look after. You also potentially could have injury. So sometimes it's hard to learn in that more injured state. Yeah. If you can master that skill, the relaxation skill, the Kegel skill before delivery, then you can start that straight away afterwards. And you don't have to be rushing to try to get into a pelvic floor physiotherapist and going from baby appointments to your own appointments.
Exactly. And getting started prenatally then too, you have hopefully some postpartum visits already booked. Yeah. So I know that Katie and Erin and Danielle all work at the clinic together when it comes to pelvic health physio, and they're 3 very busy ladies. And so, sometimes there's that urgency to see someone, but it's tricky to fit in. So if you can kind of get the ball rolling now, even better. And if you're watching and you're outside of the greater Moncton area or outside of southeastern New Brunswick, same thing. I mean, pelvic health physio it's a fairly specialized focus, and folks need additional training to what physios usually get in school. So connecting with those folks who are in your area, do that now. Even if you're not seeing them right away, then at least you know who to reach out to.
Yeah. And it is becoming more common. We're having more practitioners become trained. So where it was really difficult to get an appointment previously, it's starting to become easier and easier.
Fantastic. And so if there are any moms who are watching who have their babies in arms already, who have welcomed those little ones, what's something that they can begin doing early postpartum when it comes to healing that pelvic floor? Because that pelvic floor does a whole lot of work and can have any range of physical trauma afterwards
Absolutely.
heal. So what types of things, knowing that there's so much variation in that birth experience and the postpartum healing, again, is there sort of a particular practice that they can get started with?
So after delivery, and it irregardless of the type of delivery, because we know that cesarean deliveries still experience a lot of the same issues that someone who's encountered a vaginal delivery. I think there's a little bit of an unawareness, or women will believe that if they have had a cesarean, that it's preserved their pelvic floor, or that there's nothing that could be wrong with their pelvic floor. But the simple duration of pregnancy puts such a load on the pelvic floor that we will see women have symptoms even if they've had a planned cesarean delivery. Okay. But what we like to do is make sure that the muscle's functioning again. So after the load of pregnancy, and in particular after the muscular changes that occur in vaginal delivery, because we do see a large stretch of the muscle, and and it's meant to do so, it's the only muscle in the body that really can stretch to such a large degree and not have a massive trauma come to it. Yeah. But the nerves will stretch. So the nerves that communicate and talk to the muscles get a little bit sleepy, a little bit lazy after delivery. So I have so many women that will try to do a Kegel in the first couple days after delivery, and that I can't even feel it. Like, I don't know where it is. Yeah. So I always tell them, don't panic. That's pretty normal. You shouldn't really be able to feel that right now, but to start doing that exercise immediately, well, upon you feeling ready to do it, right? If we're delaying this by a couple of weeks because there's been, laceration, stitches, bruising, trauma to the area, or you're bonding with baby and Kegels are not at top of mind, that's fine. Yeah. But when you're ready, return to doing that Kegel exercise, and to combine it with your relaxation. In particular, women who have had quite a bit of trauma to those muscles. So if there's been an episiotomy, if there's been a high degree tear, if there was a lot of stitches that had to happen, they tend to heal in a little bit of a guarded position. So when you're in pain, picture a stomach ache, you kind of fold yourself over. The same can be said about the pelvic floor. So sometimes they will feel really weak, but they'll also be very guarded. So what we want is for them to do a combination of Kegel exercises and the relaxation exercises. One of the ways that we commonly teach that is to tell them to do a big belly breath in. So inhale, relax the pelvic floor, drop your beans, and then exhale, lift up your beans. And one of the nice things about teaching a Kegel on exhalation is that a common complaint after delivery is coughing, sneezing, laughing, blowing your nose, and leaking. And those are exhalations. So I would like someone to train for the issues at hand and not just hold your breath and squeeze, right? So inhale, relax, exhale, squeeze, and lift. And even if you can do 5 in a row to begin with, that's a beautiful way to start your recovery.
Wonderful. Wonderful. Thank you. Thank you. Yeah. And I hear you when you say too, that there's going to be areas that feel more relaxed or that you can't really feel them, but then other areas that guard. I think of, it's the body's way of saying like, whoa, a tissue was stretched or a tissue was broken. I have to protect it. So absolutely knowing when you're feeling recovered enough to begin those exercises and taking those small steps. Maybe it's 2 the first day, maybe it's 2 the first week, and then maybe it's 5, and just gradually working your way up.
Absolutely.
Yeah. And I love that connection to the breath too, because it's not only helping to relax that pelvic floor and tone the pelvic floor, but just generally relax the body. Like you say, there's so much going on, integrating, having that new little being to look after, that having another reason to take some slow, deep breaths purposefully is fantastic.
A lot of women try to do them during baby feedings. You're sitting and bonding, and you can just do a couple of breaths in a row that way, and it's a good reminder for them.
Absolutely. Absolutely. It's a nice sort of trigger. When you sit down to feed, that's a great opportunity to have some relaxation yourself as well.
Yeah.
Yeah. Yeah. Wonderful. All right. So as we're getting wrapped up here today, I wanted to let everyone who's watching know that I will, once the video has uploaded to the page to be there, I will pop in and put the link to the Motherhood Link Facebook page and their website below. They've gotten started with, or they've just launched a brand new online program. So we were talking about that a little bit last week, and it's all of the things that you find that you're repeatedly teaching. Do you find? So prenatally and postpartum.
So Erin and I, well, and Danielle as well. When we see a pregnant woman, we do like a birth prep course. A birth prep hour or two with them, 1 or 2 sessions usually. And this is information that we really feel everyone should have. Mm-hmm. So we've done our very best to develop a prenatal plan for the pelvic floor and for core muscles. We've tried to answer all of the questions that were most commonly asked, and we've designed it for women who will undergo any birth experience. So we've put in 2 streams. It's all done as modules, and you can do a little bit of choose your own adventure. Yep. So if you're preparing for a vaginal delivery and you don't want to acknowledge C-section because that's not in your game plan, that's fine. If a vaginal birth does end up in a cesarean, you can return to those modules afterwards to learn how to recover from that. But we review the anatomy and the changes that happen to the pelvic floor and the core muscles during pregnancy. We discuss different positions to help with optimal baby descent. Okay. We discuss the exercises to prepare the pelvic floor and core for delivery in the postpartum period. We review perineal massage. We review different types of birthing positions that are better for different types of issues. And then we give our recommendations for the first 2 weeks postpartum. So the things that you can be doing in the first few weeks after baby has come to help ease discomfort that you might be experiencing, anxiety about toileting for the first time, how to start recovering around any incisions that were had, and then how to wake up the pelvic floor and core muscles.
Okay. Awesome. Thank you.
Yeah.
So I'm just checking in with the comments. Lots of hellos. Hello to everybody who tuned in. I'm sorry I missed your hellos at the start. Yogita, welcome. I'm so happy you're here after your new little one arrived. And she says, I'm feeding and doing Kegel's relaxation right now.
Perfect. That's exactly what you could be doing. That's great.
Awesome. All right. So I don't see any other additions or questions. If you're watching and a question pops up about the material we chatted about this evening, feel free to pop that into the comments. I'll keep an eye on those. I also wanted to make sure that those of you who are tuning in and who are pregnant and here in the southeastern New Brunswick area, that the Enlightened Postpartum program is coming up again. We get started with it next week, and we do talk about physical healing and preparing for physical healing postpartum. It's one of the reasons I love talking with Katie and Erin, because they have that expertise on that particular area of the body, but we're going to extend that to the rest of your body and postpartum healing for your mind as well. We're going to be talking about getting started with breastfeeding and also having an understanding of what normal infant sleep looks like, especially in those first 3 to 6 months postpartum, so that you're feeling ready and supported for that time with fewer surprises. Because I kept hearing from women, nobody told me this. I'm so surprised by this. Is this normal? So hopefully, my intention is for us to cover a lot of those normals so that you're feeling more prepared and less surprised during that 4th trimester. So if you have any questions about that program, I'll pop the link to that in the comments below as well, but feel free to ask your questions there as well. Thank you so much, Katie, for being here with me tonight.
Thank you for having me.
And I'm sure I would love to have you back again at some point along the way for chatting further and digging in a little bit deeper. But I'm so appreciative for you taking this time this evening with me, and we'll chat soon, I'm sure.
Absolutely.
All righty. Take care, everybody. Have a wonderful evening.